What's going on, ladies and gentlemen? Today we're here with our brother Sam Badoo. Now, this brother is going to talk to you today about insurance. Now, of course, we always say get insurance, but this brother's, expertise in insurance, especially those of you who are thinking or actually planning, right now, because you had enough of this wicked, nation called Babylon, and you want to try something new. Those of you who are courageous enough to do that. This brother will have some information for you. So, Sam, thank you for joining us on the show today.
Hey, thank you very much for having me. I really appreciate it. It's a pleasure always to talk to you.
All right, Sam. So let's, get down to what your expertise is in the area of the insurance. Can you explain people, exactly, what you do and how that program will work?
So I'm currently a CEO, founder at a company called Fleri. Started Fleri about a year ago, based on my own background in insurance, working for a major international insurance company, primarily focused on expatriate health insurance. So for all the folks that are traveling, moving around with their families, going different places in the world, just making sure they're safe and protected. Now, what I started wondering was, if we're able to do this for the 9.2 million Americans who are globetrotting, is it possible to do for the family members of immigrants living in the United States or around in the diaspora? So that was the starting point, and basically led on the journey that got us to where Fleri is today, where we're a platform that allows African immigrants living in the diaspora to be able to purchase health insurance for their family members that are living on the continent, so they can have access to good quality care throughout the year.
Okay, so basically, now how does those program work? And let me ask you another question to follow that too. So if a person they said, you know what, I want to repatriate, let's just throw out a country, South Africa, right?
Mm-hmm.
And they want to use your program, a person, American citizen as well. How would that program work even for them?
Well, the most important part is to identify first where they're trying to go to, right? And we're talking about Africa as a continent here, 56 countries that we're looking at. We currently, through our partnerships, and we actually partner with both local insurance companies that are in these African countries and international insurance companies that can give you some additional perks as well. So we'll identify where they're trying to go to. So take South Africa. They're going to have lots of different options about different insurance policies available to them. Do they want to be able to be extracted, evacuated back, right? Options like that. Do you want a jet to come carry you when there's an emergency? Do you want to be able to fly to Europe to go get care at any point in time when you need it? So based on this, we're going to identify the right kinds of plans, and then go ahead and get that underwritten for them to make sure that when they get there, they have the care. While they're there, they will have the care until they finally leave, or if they're choosing to stay, we're talking continuous care while they're there.
Okay, so you mentioned something very interesting. You mentioned flying to Europe for care. What is wrong with the health care industry in South Africa in particular is what we kind of mentioned it, for example, because from what I read, they're about one of the top people on the continent with healthcare.
They absolutely are. Most people, if you think about it, throughout the continent, when they have a referral for a major operation or something, they will go to South Africa. Now it just comes down to just preference. So if someone who's been used to living here or lives in Europe wants to go back to where they're from for care, once you leave the country, you don't want to lose access to that healthcare system as well. So it just comes down to convenience, right? And then in the biggest sense of what we're talking about, for most people whose families live on the continent, having a visa is not so easy, right? And so there are certain countries that make it easier for you to get medical insurance or medical visas, like India, right? Or South Africa itself, right? And so we make it possible for your relatives to be able to access this overnight in an emergency.
Okay, so you had mentioned you're so American citizen, in that insurance, you can get it where you just say my doctor's here in Houston, right? That's who I trust for whatever, right? So so if I was in, Johannesburg and I wanted to go to my doctor back in Houston, I could fly from Johannesburg back to Houston with the insurance. Is that what you're saying?
Yeah, if you got a policy that had evacuation, yes, absolutely, that will happen for you.
Okay, all right. So it covers what all does the insurance cover? It covers medical. What else?
So we're talking comprehensive care, right? And our focus is on health insurance for the African continent, paid for by relatives in the diaspora. So this is comprehensive. It doesn't include co-pays and there are no deductibles. The goal was to keep it simple, right? So it covers the medical part. It's going to cover your dental. It's going to cover your surgeries. It will cover your optical services. Basically, all of it put in one, including pharmaceuticals, right, to make it easier for that person that you love to access that care.
Okay, so basically, it's health insurance when you're on the continent. Because some people have asked that question, say, okay, well, I get to the continent, then because we used to having health insurance here. Well, what kind of insurance I would get? So basically, you're saying is call your company and say we can get you the care that you normally would have with the option of you willing to pay for it, the option of you want to fly back, to the U.S. For
Yeah,
care because you just trust your particular doctor here for some reason. That's basically what you're saying, right?
that's exactly what I'm saying. So if someone was leaving here trying to travel back because they want to move to Africa, right?
Mhm.
And don't get me wrong, there are really, really good facilities. I'll give you an example. Luca Health, recently built by a number of African Americans from the tri-state area, right? And Luca Health provides, top-notch service. You can take, for example, Eurocare, right? It's in Ghana, it's in Nigeria. Eurocare flies doctors from both the UK and from the US to see people right there in Ghana or Nigeria. So there is access to good quality care. But if you feel comfortable coming back, all of that could be arranged. And that's what Fleri does.
Okay, so let's talk about another thing people like to talk about and focus on is what does it look like per month? I mean, on the low end, or even the high end. What is it looking like per month? Or is
So
you do it for the year?
yeah, we're talking about getting insurance for your relatives who live in a city or a town somewhere in Ghana. You're starting for as low as $15 for a telemedicine consult, right, a month, to 25, and it goes up based on the benefits that we're starting to throw in, and then on the high end you could be looking as much as $800 a year, or about 2,000, 3,000 if you're trying to get on a Cigna policy, for example, or even much higher for around 7 or 9,000 for a family of 4 or 5 that wants to have up to $1 million in coverage and extras.
Okay, and they can pay even those higher end policies per month, or is it per every quarter, or how does it usually work?
Yeah, so we like to have flexibility with our customers. So we're talking monthly, quarterly. We're talking about by semi-annual plans, and then annually as well.
Okay, all right. So they just go to your website and then they say they can get more information. And what's the name of your website again?
Yeah, so you go to www.joinfleri, Fleri, joinfleri.com, and we'll have one of our specialists talking to you to quickly understand, whether it's a travel, senior care, individual, family plan you're looking for, particularly on the diaspora. We'll be able to help with that.
Okay, and on your website you have like someone giving, was it a testimony or reviews or something like that to kind of let people know how that works?
Yeah, and we've had lots of different people who purchase policies for not just themselves and their families, but we're talking about people who are also trying to do good on the continent, right? Um, just think about it: for $15 a month, less than your Netflix bill, you could be providing healthcare to a group of people who just haven't ever had it. And some people use it as an opportunity to give back to the communities where they were from. So it's for different reasons why people patronize it. But ideally, it's extending a little bit of grace that we happen to have here that our families back home do not have, especially at a time like this.
Yes, sir. So, Sam, we definitely thank you for, joining us on the show today. And ladies and gentlemen, please go to Fleri.com. We'll put that in the pinned comment. And those of you who, like I said, maybe have family on the continent, or even, now you could, have opportunity to get some insurance on a continent while you're there. Because even if you're traveling there, it would be good just to have something, just because you never know. You just never know. So, Sam could definitely, his team could definitely help you with that. So, brother, we thank you for joining us on the show today, and you stay blessed.
I appreciate it. Thank you very much.